right, ladies and gentlemen, let me know when you're good, Prime.
Um, give me a bit.
Okay, okay.
Save changes. Okay. Um, and I guess I'm going live now. Um,
Boom.
Are you following the mayoral race? I guess that's more relevant for you, or I don't know, closer to you.
Um, for LA,
Yeah, or I don't know. I guess it doesn't really affect you, but I guess it's
I mean,
closer to you than me.
it's shocking to me that it's like it is a problem. I think I don't think that the amount of people voting in primaries is so high that you're going to see double Democrat a lot of the time. I think it's if we wanted to see that, we should really be pushing for ranked choice voting.
Mm.
But yeah, I think it's kind of unrealistic to begin with because I mean there are 30% in a general election is going to be Republican, right? So I mean there are enough of them to sway these primaries pretty successfully. So I'm not surprised about the governor or the mayor at all.
Do you have a preference?
Oh, Dems all the way. I mean, for sure. I wish that Steyer would have like made it. Probably Steyer would have probably been my.
He's like
Um,
the wealthy person. I believe he's wealthy.
he is a billionaire. Yeah, yeah, it is pretty weird.
he's got a little bit of cash, yeah. Um,
It's not the reason why I support him. Unfortunately, I mean, it is. It's unfortunate, but he is at least a billionaire that has been funding Democratic stuff, for a long time. So I feel like that's um he's trying to put his money where his mouth is on that stuff. But yeah, I mean, yeah, it is what it is. Uh,
um,
Go ahead, Prime.
I was just letting you know in the group chat I got the stream together
Yeah.
thing. And the stream together link. And I'm just gonna go and get some water and go to the bathroom, but I can still hear you guys, so you guys can talk or get the stream started, do whatever you got to do.
Okay.
Mm-hmm.
Yeah, yeah. Yeah, man. I think California has an onus to be trying new, progressive ideas. Like progressive in the
I agree.
true sense of the word of like using legislation in order to improve people's material conditions and society. And as Democrats, we believe in that, right? We believe in progressivism. Um, and I feel like trying new tactics, new legislation, and I don't see that necessarily with Becerra. I see him kind of as a establishment career politician that's kind of just been around, for a really long time. I don't understand how he got picked for HHS secretary. I don't understand how he thought that he would be a good governor. Um, but here we are. Here we are. So it is a little frustrating. I know exactly, Nico. Nice to see you, brother. Nice to see you, man. Yeah, I think that as the fourth largest economy in the world, like we have, and as the economic leader in the United States, we have. I think we should be, pushing the envelope and trying to um, do things productively. But and my fear is that Becerra won't push that, won't kind of try to rattle some cages and kind of just stay in his lane. And you kind of saw that as soon as he got into the lead, when Stallwell dropped out, he was putting out all these like, this is what I believe, single payer, blah 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 blah. And then as soon as like he got into the lead with the polls, he was just like, well, maybe single payer isn't the best. like he really retracted really instantly. And I was like, wow, this is kind of this is unfortunate, you know.
But yeah, from as an outsider, a Canadian,
Mhm.
by my estimation, California is like the most progressive state, at least from what I can tell. And so I would agree that it should be sort of like, let's say, pushing the envelope and not afraid to experiment. And it's like, if it works there, or like I think, California should be like the most experimental of like trying progressive policies. And then if they don't work, like rolling them back as quickly as possible. That type of thing. Although I think every state should and every country
Yeah.
should take that approach. But
Yeah.
and I'm assuming you're not a Spencer Pratt fan.
All right, I'm sorry, family emergency. I got to be back in 2 minutes. I'm sorry.
Okay, no problem. I'll hold down the fort. Well, he appears to have had an emergency. He'll be back. I guess I'm left here alone to entertain people, although I'm probably not the most entertaining alone. And I don't know what to do to fill dead air. Yeah, exactly. I believe Dr. Greg has 4 children, so essentially an army of children, so that's a lot of responsibility. So understandable that he has to attend to whatever comes up. As opposed to me and my 0 children. No one demands my attention except for myself. Yeah, Tallarico seems pretty based from everything that I've seen. Although I've mostly seen some clips and some YouTube videos. I saw his Jubilee appearance, which I thought was pretty good. And just about every interview that I've seen of him, he seems like an overall impressive person. Even though I'm definitely not a religious person by any measure whatsoever. But let's say, yeah, if I would want a politician that, let's say, is religious and that does not seem to either weaponize or does not seem to be solely guided by their religion, Tallarico seems in that vein. And yeah, if it helps or promotes some religious people moving to the Democratic Party, because it seems like overall the Republican Party has kind of like a monopoly on religious people overall. And it's been interesting to observe how whatever the Republican media apparatus has kind of tried to poke fun at Tallarico. As usual, taking aim at his lack of masculinity or perceived lack thereof. I believe he's like mischaracterized as a vegan, although I see being vegan as a positive thing.
Jeez.
Hopefully everything's okay and in order.
Vasectomies are fast. They're relatively painless, guys. Like within, like honestly, it's like 15 minutes and you're in and out, and it's just like you're uncomfortable for a couple days, but like it's not bad. It's not bad at all. Just letting you know. Just putting it out there. Just letting everyone know. Just letting everyone know.
Sponsored by Big Vasectomy.
I can't even tell you. I can't. You don't even want to know. There's not even. Okay. Sorry.
That's
Together as one. Okay. Our first story of the night. China's rise in drug development looms over U.S. Clinical trials in China are getting attention at an international oncology gathering in Chicago. China's surging biotechnology industry is fueling an alarm that U.S. dominance in the field is waning. For decades, an annual gathering of oncologists has featured drug trials that were run mainly at American and European hospitals. But this year's meeting, which is being held in Chicago this weekend, the signs are everywhere of China's ascendance as a powerhouse in drug development and the threat that many believe it poses on American biotechnology. The clearest sign it appears to be a first. One of the conference's 5 coveted headliners is a presentation of a clinical trial conducted only in China. So,
Bad signs for U.S. biotech.
yeah, man. I mean, look, it's one of those things where, China has had a lot of publications for the longest time, but the biggest problem was reproducibility and the fact that China was like stealing IP, that people thought that they were basically
And
unchecked.
fraud, to be
Yeah.
honest.
Yeah, like they're.
High publication rate, but also pretty high fraud rate as well.
Yeah.
Not like sky high, but it's definitely not great.
So if they actually got into creating more reproducibility, higher like tier quality, publications, I think that it's always been something that the United States is kind of like dreaded. But the fact that they're actually getting into medicines for humans, I think it's completely valid to think that China is definitely on the rise on this stuff.
Testing, can you guys hear me? Yeah, you can hear me.
I can hear you.
Would that be a problem? Like, the way these things are usually presented in the press is that, oh my God, the rise of China. Oh no, what can be done? Something is like, this is a sign of the end times. But like, hold on. So you're telling me that China is making better cancer medicines than the United States? Are they going to hold it away from us? Are they going to keep it away from us? No, they're going to sell it to us. Oh, okay. Well, then that means we get better drugs.
Yeah.
What?
Well,
and I think what would be a problem is not that China gets better, right? That's fine. I think the problem is if the U.S. is falling comparatively, right? Like if the U.S. Institutionally, right, or through policy means, can't produce the level of scientists, or is scaring away the talent that would be producing the next generation of breakthroughs. That's the thing to be concerned about, right? But then that would be the U.S. falling relative to the entire world, right? It had nothing to do with China. The idea of China like creating better drugs, well, great, as long as they sell them to us, then we all got better drugs.
So I'll try to steelman the other side, or the article does try to highlight some of these concerns. That they do definitely frame it as sort of like this is a negative thing, or there's definitely an aspect to this article. But like pretty much what you alluded to of like if they're selling them to the United States or other countries, not a problem. But that is, let's say, the concern. As in, generally speaking, the United States does tend to lead the way in terms of novel drugs that are released onto the market. But then if a breakthrough drug is, let's say, first discovered and approved in China, that potentially opens the door for some sort of risk on the United States or other countries, part of like this can be used as a bargaining chip, or rather now U.S. patients no longer have access to whatever top of the line care, right? They could potentially be locked out or priced out.
The U.S. might suffer what it does to everyone else.
True. Yes.
Right. Like the U.S. imposes sanctions, including medical sanctions, not just like like military sanctions, but medical sanctions against plenty of other countries, including Iran and Cuba. Right. And because of that, a lot of people have died. Like there's estimates, I don't have them off the top of my head, right, of how many of the sanctions have killed in Iran and Cuba and other places that they've instituted these things. Right. These things have real consequences. Oh no, the U.S. might have to suffer the same way the rest of the world suffers. And you know what? And here's the thing that would happen, right? Here's the actual play, right? If China did cut us off from that technology, you know what we do? You know what we do? We'd steal it. That's what would happen, right?
Probably, yeah.
They've cut us off. Well, we, unlike Cuba and unlike Iran, right? Well, see, we have the medical technology to replicate whatever drug there is, right? Unless it's something like so like revolutionary that like we literally don't have like we don't know like the tools or processes behind it, right? Some
That,
brand
definitely.
new breakthrough. Other than that thing, right?
So, but the
Like we
question, Prime,
like if it's a pill, we can replicate a pill. Sorry, go
the
ahead.
Prime, where are the medications produced?
That's true
Yeah,
too.
there.
In China.
Yeah,
Exactly.
yeah.
So that's the idea where it's like they're
Until
already
Trump
being
brings back manufacturing, right? It's going to happen any day
yeah,
now.
yeah,
Uh,
yeah, exactly. So the point is like they're already being produced in China, and people they kind of like already have they kind of take what they're producing for us and then create their own companies to create that medicine for China only, and then give it to, or manufacture it for the pharmaceutical company. So the idea is that, well, if they have it and they're producing it and only they have the technology in order to produce it, therefore they could just charge us whatever they want in order to like artificially
well,
dumb up the cost of the medicine.
yeah,
That's
so
the
they
theory.
would be like any other American pharmaceutical company charging us ridiculous prices for medication. They would fit in with all the rest of the crowd. Is that what you're telling me?
I mean, I think they Pfizer and these other companies are global companies. They're not just in the United States. I mean
Yeah,
they
they
do
charge the
FDA.
U.S. inflated prices. Yeah, we know we get charged more than anywhere else in the world, right?
Mhm.
Like, and sometimes they'll say like, oh, well, see, the reason why we can charge those other prices in the rest of the world is because, well, the U.S. subsidizes that. So you're subsidizing us? No, nonsense, right? The reason why they charge us these prices is because they're allowed to. They're allowed to charge us or whatever they want. Like the U.S. Government isn't allowed to negotiate these prices
Mhm.
down, even though we absolutely should. That's what other countries do. They negotiate with these countries. Like Japan negotiates every single medical item, right? From medicines to medical equipment, right down to the band aids. They negotiate every single thing, right, to get the price down. We don't do that here in the United States, and so we suffer the consequences. So you're telling me that China might like inflate the price of a drug? Oh no! what
Well,
a
I mean,
crazy thing!
but it's also that, but it's also the regulatory capability of it too. So the FDA, like in what world? So because of the FDA mechanism of how pharmaceutical companies pay for their FDA approval, because we don't want to, we want to charge billion-dollar pharmaceutical companies their own development, research and development costs. Like how are we as a country going to deal with something that has only been approved through the Chinese process? So that's
We'll have
another.
to. No, wait, what is this? This is nonsense. Right? They'll have to go through our FDA. They want to sell to the American market, was a lucrative market because they can charge us whatever they want. If they want to go through the American market, then they'll just have to be approved by the FDA.
They'll say no.
Simple.
They'll say no. They're
Oh,
not
okay.
going
Well, then
to
they don't
FDA
get to
approve.
sell it. Done.
Exactly. So now that's the
So,
problem. Like, I think that I think they
why would they?
will.
They say no? Why would they say no? This is what this is an imaginary problem. Like, why would they say no? They want access to the American market, right? So
Mhm.
why wouldn't you want your and plus you want people to feel that your drug is safe. So they put it in their mouths, right?
Yeah,
And they like open up their pockets to get the drug. And so why wouldn't they go through the FDA process? And if it's
it's not
not
funny.
FDA approved, like then people won't take it. Or they won't even be afford to take it because it won't be covered by the insurance. They
It
want to
costs
be covered by insurance to get the money.
it just costs too much money for FDA approval. They'll say we already have our own approval process, just like how we use the other countries use the FDA as their own approval process. Like
What?
we don't want to have to approve the FDA.
This is nonsense, Greg. This is
It's
nonsense.
billions of dollars, man. Why would
No, no,
they
Greg. They can afford their pharmaceutical company. They can afford to do it, right? What are you like? You're saying that the Chinese can't afford it? Well, then, if that's the case, then what we should do is assist them. Then, like, oh, okay, there's a novel drug, but we do need them to get through this testing process, right? And for some reason, China isn't going to help their own companies, right, meet this regulatory burden. Then we should help them. right? We should say like, okay, well, if it costs this much, let's subsidize this cost somehow. Let's give you some sort of grant or whatever because we want access to this drug. Let's make sure you get through this process, but make sure the process is done properly, right? But if it's just a matter of money, provide them the money, right? That'd be money well spent. Provide them the money for this good drug, and then they go through the process, they are approved, and then we're done.
I mean, I agree that the pharmaceutical companies have the money if they're seeking for FDA approval, but I think there is a little bit of question of like whether they would, or rather, there could be a calculation. I can foresee a calculation where it's not actually worth it, as in if they have access to a global market, but then the barrier to as in the market access in the United States is not worth it for the FDA
How
approval.
would it not be worth it? How would it ever not?
Well, it depends on the drug. Like depends on the market of the drug.
Billions more.
But,
Right?
but it depends on the drug. Not every drug. There are certain
Oh, you're
drugs.
good. That's fair. That's fair. But yeah, that's fair. But like, I don't know, man.
But I agree with you that overall, it's always worth it. The United States is a huge market. There's lots of money floating around. So in general, I would agree that it's almost always going to be profitable and in the interest of a pharmaceutical company to get access to the U.S. market. I overall agree.
Yeah. I don't know why. Yeah, there'd be no reason for them not to do that. And then that's the same. And that's the same barrier of entry that every company has to clear. Right, all of them have to clear this. Even small pharmaceutical companies have to clear that barrier. If we have a problem with that, then we should maybe somehow figure out how to lower the barrier. Right?
That's
maybe
true
subsidize,
too. Yeah.
I agree with that. I mean, I've always been on the side of actually like broadening the FDA approval so that the more experimental things can like be experimental.
But that requires a larger FDA and larger, which obviously is not going to happen anytime soon.
Yeah, exactly. I mean, but the idea is like with the hegemony of the U.S. leading the FDA and research and development, it's all here. It's all going through the FDA, but there could be some political or economic point where they just say that the US market like isn't worth it. Like because pharmaceutical like medicines isn't that much. Like the margin isn't that much on these medications. It really isn't.
Which one?
True. I mean, but for the most part, like they're like the manufacturers themselves aren't making a ton of money on these things. It's not like we're talking like, you know, like on the order of like the natural path stuff is like, you know, 600-700% markup.
Well, that's because you're literally manufacturing nothing and then selling it. That's pure profit.
Yeah.
But all you're saying, right? You're describing the economics that any company has when coming to market within the United States, right? Okay, there's a regulatory burden I have to clear that costs a certain amount of money versus how much do I expect to generate, like selling this product. That's even on all levels. So, like, what difference does it make if the drug comes to China? Like, there's not a China specific problem.
Could you say that again? I'm sorry.
Sure, no problem. No worries. I'm saying that like this is a problem across the board, right? I don't know how much money it costs to like clear FDA trials, right? Let's, for the argument sake, say it's 1 billion. Okay, yeah, sure. But like, yeah, that's how much it costs. Well, then all companies have to do that, right? So this Chinese company coming into the U.S. market would just be treated the same. So like, I don't know, like there's no reason. Like I'm still looking for like why I should be concerned that China might be better positioned to provide these drugs.
I think in general, if there was a arms race kind of thing, like with NASA and Russia for the moon, you know, like I think that it would actually benefit us. Like in general, they have competition, you know, for research and development competition. I think that maybe it might behoove us to like, you know, increase research and development spending, that kind of thing. But I guess I do think that you're right that there would be some, you know, people that would see some type of like the mechanism at action and stuff and then try to reverse engineer and to create that medicine here. And I do think that would absolutely happen. So in general, I think it's a benefit, you know, but I'm just saying the fear of what we're talking about is the idea of a Chinese tested from medication that we haven't approved, that we don't understand, like but it's really good to the point where it's like, well, they're already manufacturing it, it's already there. Let's just go with it. That's the fear.
Um,
And we'll
sorry,
pay a
sorry.
markup.
What's the
We'll
fear
pay
here?
like,
Fear,
if they're saying, "Hey, we're not going to pay the FDA approval, and we're just gonna
yeah.
charge you 2 to 300% markup, and that's cheaper for us than the FDA approval, and we're just gonna go it that way." There could be a scenario where in the future that we do that with a
There's
Chinese.
a drug without FDA approval that is being. I'm not sure if it's illegal to sell a drug period without FDA approval. I'm not sure about that. I don't know. If it is illegal, you can't sell it at all. Okay, well then if you
Not that I'm aware of. Yeah, correct.
it,
Like, well, if
if
you're
it
making a claim, if you're making a positive claim about something that you have to. I mean, there are vitamins and natural remedies that aren't
yeah.
FDA approved, right? That's what the freaking rosemary tinctures and stuff that people sell, all the time are for. But it's just
Mm,
a completely different thing. You don't have. It's not a pharmaceutical.
this is not this is a non-argument. I'm sorry, this is a non-argument. Like if they want access to American market, right? Every company wants their like biomedical company wants their thing to be FDA approved. The moment you get that stamp of approval, that opens up all kinds of revenue streams, right? Most important, well, two big revenue streams, right? That would be insurance, right? Private insurance, and also that would be Medicaid and Medicare, right? Like then once it's FDA approved, then it can be charged there, and you can make a lot of freaking money that way. They all want their thing FDA approved, so it makes no sense to unless it's one of those drugs where it's like, those really unfortunate people who suffer from some like kind of rare condition where like 20 people in the world have been identified as having this thing, right?
There are some niche
That's your
conditions
mark.
where that happens, but like yes, it's very niche.
Yeah,
It's a minority,
yeah,
but
exactly.
it still
But then
matters.
again, those absolutely still matter. It's very unfortunate that they're in that situation. You want your illness to be popular. Unfortunately,
You do,
that's a crazy thing to
unfortunately,
say.
yes.
Yeah,
Here it is.
but that
But
problem would be the same for a German company. It would be the same for a British pharmaceutical. It'd be the same for all of them. So once again, no reason to be concerned that a Chinese corporation is providing this drug.
But the difference is that we're not manufacturing our medicines already in Germany. So this is where how it's written in the New York Times. So this is where I'm talking about.
Okay.
For now, big multinational pharmaceutical companies are developing most drugs invented in China for introduction to the US market. But some fear that if more Chinese companies assume a direct role, American patients could become dangerously reliant on the Chinese government for access to vital brand name drugs. Dr. Richard Pazder, who was a FDA's longtime top cancer drug regulator and briefly led its broader drug division late last year, was well known for refusing to approve cancer drugs based on data collected only in China. Now, quote, regulators must prepare for an environment in which some therapies with substantial patient benefit may be studied primarily or exclusively in China.
This like the New York Times is struggling. Wow. Hit piece after hit piece, right? The Grand Platinum one and this as well. Like what a oh my god. Seriously? First of all, I got news for
Mhm.
those patients who might be vulnerable to Chinese made medicines, right? As we said previously, they're already made in China. All your medicines are made in China. All that stuff fine. We found out about this during. I mean, if you weren't paying attention, you found out about this during the COVID era, right? When we were cut off from that. That was the big issue. Yeah, globalism has a bunch of strategic issues, especially when you're talking about critical infrastructure. Yes, and we outsourced, right? These companies outsourced our capabilities to China because it's cheaper that way. We just like allowed that to happen. Okay, so any which way, that's where all the manufacturing is happening in China. So I didn't mean
Yeah.
to point at Corey.
You
But
can point at me. It's okay. I am half Chinese, so it's all my fault. I'll take responsibility.
but China somewhere, somewhere out there. But
Mhm.
yeah, like it's already the case. So like this thing to be able, and then like oh no, it's only studied in China, and so I guess the implication is that the Chinese would adulterate their results. Well, news
Well, no. So,
headline. Sorry, go ahead.
uh, again, I'm just steel manning the other side. I'm not saying, but like it is. Let's
Okay.
say the tiniest of concern. Of the concern is if for example, like if the clinical trials to approve this drug only took place in China, essentially
Mhm.
tested on a Chinese population, there is the potential. I'm not saying it's actually realistic, but there's the potential concern that the drug will not work as well in an American or non-Chinese population.
Oh, okay. So when we have drugs that are
Because
primarily
the FDA says that
test,
it approves drugs for the American
Dude,
population.
but the
so
FDA
on.
is very stringent, Prime. That I mean, that's the thing is they are very conservative, like as in a cautionary tale. Like they are very so the idea and
Cares.
the bar is very high to get FDA approval. So, and that's what we're
For
talking about is that like do
years.
these like Chinese regulators have that standard
Nonsense.
of
Well, then
the
if they don't have it, then they have to go through the FDA. They have to get approved. If they don't meet our approval bar, then they can't sell to the American market, the very lucrative American market that they want to get access to for the big money, right? So anyway, right? Like for years we've heard about like how drugs, right, are primarily tested on men, right? Particularly white men, but on men, right? So we have decades of drugs being created that haven't been particularly calibrated for women, or we to even understand exactly how they would affect women, or different more niche ethnic populations. That we don't do that right now. Oh no, the drugs will be tested on the Chinese, on Han Chinese individuals, right? Oh no, what could happen? I guess white people would suffer the same thing that we've all been suffering from. Like, come on, like this is not like the struggle here. The
Yeah,
struggle
I don't
here.
disagree.
Come
Like I
on.
said, I'm
Yeah,
just trying to steel man the other like that. I'm
yeah.
not particularly, but also I guess I'm biased. I'm half Chinese, so I win either way. But
Corey's
like,
time has come, right? Like, I think
but
again,
that,
I think we should test like in general on more ethnic populations, and to be testing if it's a general drug based for men and women, right? Test on both, right? Make sure we have both populations included there, right? For the American testing regime, the Chinese don't have to worry about this so much, right? But like for the American testing regime, yeah, that should be the case, right? And those that Chinese companies should have to clear that bar if they want FDA approval here. But to say that, oh no, oh, like the test results might be skewed because only Han Chinese have been like, okay, great. And remember, the rest of the world, like you guys said previously, the rest of the world goes by our FDA approval. So if we are the ones who take on that burden, right, for the rest of the world, then why haven't we had an ethnically diverse testing there, right? Because people from Ghana, right, they're going to be buying those same drugs. Well, the FDA approved it, right? So I guess we'll get those same drugs. Was it not a concern then? It's like all of a sudden now a big concern.
yeah, no,
That like yeah. So,
I'm on the same. But let's again to steel man. But we do have, let's say, a real world historical example not that long ago of the extreme example of okay the mRNA vaccines. Okay, like those came from the United States, and they were first, let's say, given emergency use authorization in the United States, and I'm pretty sure the U.S. population had the quickest access to the mRNA. Even up here in Canada, there was a little bit of a delay for us to get them. Even
makes
even
sense.
though we were closely tied, but I think the concern, and again, I'm not saying this is a hugely valid concern
America
as of
first.
now, but like, yeah, the concern is okay. The next, requirement for an mRNA vaccine, if that comes out of China, well, then China will have first access to it, and then the U.S. will no longer be prioritized. Now,
Oh
obviously, as a
no,
Canadian, I don't view that as a bad thing because we're not prioritized no matter what. But from an American
as
perspective,
God
okay,
intended.
from an American perspective,
You come with the 51st
America
state that solves that
is
problem. Go
for the
ahead.
last
Sorry.
whatever it's okay, for the last whatever 60, 70, 80 years has not been used to not being, priority number one, right? And so the concern is, oh, we're maybe not, we will not have access to the breakthrough medications because they'll be coming from places like China.
Then we should invest
I
in
agree
science.
that, as in, like, that should be the response. Do I expect this
Yeah.
administration to do that?
Yeah, and that should be the response rather than this like nonsense like fear mongering over China. Oh no, China
Sure.
might actually do some good for the world, right? By giving us cancer medication. Heavens to Betsy's. Like,
Well, okay, okay.
what is this?
To be fair to the article, they do mention this. 1 second. Yeah, yeah. On the other side of the debate are those that warn that throttling competition from China would deprive Americans of new medicines. Ultimately, they say the best data, no matter where it comes from, should win out. So that
Yeah,
is included in the article, as it's
yeah,
not inherently a bad thing per se, or more or
It's
less.
a great
So,
thing. More
yeah.
medicines is a great thing.
yeah.
Or
I think
do what the last thing, very last thing, or do the thing that Corey and I have talked about previously on the Reverie, right? And say, screw IP laws, right? Like if that's like let's lower the barrier of
Yes.
IP laws, right? So that we can access these drugs quicker. We have raised IP laws and built these like fortresses for these pharmaceutical corporations, but which they've asked for, right? And now maybe it might come to bite us in the butt because what if the Chinese create something and our own IP laws keep us from accessing it? That'd be amazing. And last thing, I would love it. I honestly, I want this to happen. Right. Here's the thing, because I would love. Oh my God, I would have an orgasmic reaction
right.
if
On
like
stream. No,
the
just kidding.
oh my God, it'd be messy. It'd be really messy. If the Chinese corporation brought a drug to market and then charged like like something with it like 1,500 a bottle or something like that, all right? And then we get a news story from Fox News talking about how dare the Chinese like cost us this. It's an attack on America, making us pay this much for medication. Who would believe that would have to pay this much for medication? I would
Yeah,
look, and
that,
you
that would
know they
probably
do it. You know they would do it.
absolutely. That would probably
Because
maybe start swinging the tide or public opinion against IP
Exactly.
law, right? It's like, oh, if
Yeah.
we're being locked out and we have to pay exorbitant prices, well, then yeah, to hell with
That would
IP.
actually be useful. That
yeah,
would be a useful thing for China to say that one, we lower IP laws, or like, hey, why don't we negotiate those prices? We can negotiate with that Chinese company and say, actually, we're not going to pay that much, right? We can negotiate with other companies too, German companies, right? American companies can negotiate with all of them and say we're not going to pay those exorbitant prices. If it took China to do it, then I'd be ecstatic. Please, China, save us.
the next level thing. I mean, I think Prime. I think that you raise a good point in the fact that like if it's so important for national defense to make these pharmaceuticals, like we should look into nationalizing production of these pharmaceuticals.
Hmm.
That's just like what it is. If that's what we're talking about, then let's put where our money in the mouth is and bolster our national labs and to create a way to do this. I think that we should do this with vaccines personally. Like I think they're economically actually almost a loser for these pharmaceutical companies.
Hmm.
They don't make nearly any profit for them, but it's an 11-to-1 economic driver for governments, so it makes sense to do that. But then two, I do think that the next level nefariousness would be basically to do something where they can create something that is near cheap on mass scale because maybe they need it or something like that. Like imagine GLP-1s for, oh, you're getting charged, you guys are getting charged $200 a month for tirzepatide. Well, guess what? From these China, suppliers, you can get it for $10 a month. You know what I mean? The first one's free. You know what I mean? So you buy in, and all these people are like, "Wow, this is incredible! China's giving us all this healthcare. This is incredible." And then now that they have you, then they could have like some political sway and be like, "Hey, guess what, guys? They're charging us. It's not fair to us that they're charging this other thing or this tariff, this input thing. And guess what? Public opinion would be against the United States government in favor of China. So like, I definitely think like there could be some way that if the United States doesn't invest into our own pharmaceutical production or our own research and development, like you could definitely see people favoring China and because yeah, guys, pharmaceuticals improve quality of life. That's what they do.
This I love what our friend Dr. Greg said. Like this is a capitalist sickness, right? To
Mhm.
like think that, oh, these products that are life saving, right? need to be made a profit off. That like that only the private market is capable of creating these medicines. The U.S. government used to create medicines. It used to have massive public health campaigns where it would just like give medicines out to the population. We could just do that. There's no reason why the United States government, with its resources, can't actually just like decide, yeah, we're gonna just make the medicines, right? Like you start with you know um like generic drugs, right? Start there and build our capacity. And we could also do like the vaccines or drugs that like for Dr. Craig should, whose margins are quite low. I mean, like you just want your population vaccinated, like period, right? That's a great thing. It makes them more productive when they're not sick, right? Right. So you want to get that boost those vaccination rates up. It's just a good idea. Do that, right? But then beyond that, yeah, we could actually go for medicines that just are low margin. Maybe the ones with like those small amount of patients, right? Where you just can't get a pharmaceutical company to put any money behind that, right? Yeah, the government doesn't have to make a profit necessarily, but like there would be so much public good if the government directly invests in them. We could just do that. It's like the part of like creating our like neoliberal reality, right? It's to like shrink people's imagination as to what's possible, right? Well, of course, like a private company must be the one to produce the drug, even though so much of the innovation comes from U.S. public universities, right? From U.S. schools doing the work on their own behalf, right? Yeah, but like a private company has to be the one to take it to market. No nonsense. Capitalists came up with that idea, right? No, the
Yeah.
government could just do that. We could just invest in this, like expand your imagination for what's possible.
Yeah, we have national labs in the United States right now. Like they still
For
exist.
now.
They're being gutted right now, but yeah.
Yeah.
Corey, any last thoughts on this one?
No, like as in I don't view this as a neg, but again, I'm biased. You know, I live in both worlds. If the U.S. rises, I largely benefit as a Canadian. If China rises, you know, I benefit as half Chinese. But at the end of the day, like this competition from China, I view it as a good thing. But like I understand the concern, or let's say the concern is like the fall of the United States. Not that improvement to China is a bad thing, but rather like whatever, the United States is no longer leading the way. But like if this competition from China inspires or results in more investment from the United States in their research and development infrastructure, then I view that absolutely as a good thing. Because like, yes, if you're going to be a capitalist and advocate for that, then competition should be a good thing, and that this should inspire the competition.
Yeah.
Are you eligible for a Chinese passport? I'm just curious. Like
I've never looked into it, but I would imagine I do have family there. I have grandparents there.
yeah, I'm curious. I had
But I
another
haven't
friend
actually.
who has American heritage from another country, and they technically should have American passport, but like they don't have the documentation anymore, like to prove their lineage, and so like they're locked out of it. So I'm curious if you can do that.
My middle name, which is on my birth certificate, literally translates to, well, assuming my father didn't lie to me, translates to of Chinese origin. So I think that should be.
That's like
Really-
what the immigration
really on
officer
the
put
face.
in
That's really-
when you're coming in. Yeah.
Made in China.
That's pretty much like, again, assuming my father was, which I don't think he was. Like, I have my name from my mother's side, Corey Campbell. Like, so that was my father's way of getting something in there.
Well, yeah, we'll have to see. I mean, hopefully, if more Chinese research and development leads to medicine, it will spur more research and development in the United States. Unfortunately, China is like taking over renewable and sustainable energy production, and we don't seem to be following suit there. So I would hope that maybe on something else, like they would actually follow suit. But guys, I can't believe it's happening. Nearly 60 Idahoans sick after drinking raw milk in past 2 weeks. I can't believe this is happening.
Who would have guessed?
We reduced raw milk regulations, and people are getting sick drinking raw milk. This is crazy. Idaho health officials are investigating how did nearly 60 people got sick after drinking raw milk in the last 2 weeks. The Idaho Health Department announced in a news release on Wednesday that most of the people reported being sick after drinking raw milk from 2 different milking operations in North Idaho. The infections were reported starting May 19th. The state agency didn't disclose the names of the dairies, because why would you want to help people, but said they were collaborating with health officials to, quote, identify and fix any potential sources of contamination. In a statement, Department of Health
Is
and
that fixed
Welfare.
pasteurization? That's the question. But keep
Yeah,
going. Sorry.
hey guys, maybe you should start pasteurizing. Just letting you know. Said the agency didn't name the milking operations because, quote, because this is a potential risk for any raw milk producer, end quote. Actually based. He's like, if you're drinking raw milk, that's a bad idea. So it's like they're actually kind of using a little fear and tainting, like poisoning the well.
Yeah, I see what
You know
you're
what I mean?
saying. Yeah.
Quote, the milking operations are working with public health officials to figure out which patches of milk might be affected and to take the steps and remedy the situation. Wow.
Yeah. So actually, when you brought it up, it didn't actually, let's say, register me of like, yeah, they're not naming the companies, but like, in that context, that makes sense to me. As in, like, if consumers don't know which brands to avoid, then hopefully the calculation is like, well, any raw milk is a risk, and so don't buy it.
Yeah.
Because any raw milk is a risk, as it always had been.
Like, what are you guys doing?
Yeah.
The guys like, yeah, what do you? So, yeah.
Breaking news: people played Russian roulette, and a few of them lost. Like,
Yeah, exactly. Dude.
This was literally inevitable going to happen.
You know, it's so, this is one of those things where I really, there's no benefit, there's no possible reason to drink raw milk. There's like zero, like genuinely zero.
I agree with you. Like, yeah, I'm just curious of like what will it take? So far, from what I gather from the article, like there are people that have fallen sick. No one has died yet, but I'm curious, like what body count needs to happen for something to change, or for 100% of the population to realize.
Corey, how many people have to die of COVID before we realize
True,
that they should get vaccinated?
That's
true.
That's
1.2 million.
Touché.
1.2 million. We just had Memorial Day, right? And the amount of combat deaths from every single war the United States has ever had, the combat people like Saving Private Ryan, you know what I mean? People losing their life on the battlefield, okay? All of those together, 1.2 million. 1.3 million. COVID, 1.2 million. And we don't have any like COVID Memorial Day. We don't care about them. Like we don't have, how is that patriotic? It's so asinine to me. But I was thinking that too, like 60, 600, 6,000, 60,000. Like when do you actually like start doing any of these bills? I'm actually curious. Idaho recent raw milk
and
bill.
It's so strange, or at least to me strange, I guess obviously not to many Americans, but like, so there's a lot of rhetoric, even from the president of the United States, of like, from the, characterizing these third world countries as bad. But this is like a third world problem of like, our milk regulations in Canada, I believe, from what I can gather, are stronger in Canada, the United States. Of like, from what I recall, like, selling raw milk for consumer consumption is illegal in Canada. Like, it just can't be, unless like I own a cow and I milk it and drink that milk. I cannot sell raw milk, but that does not seem to be the case in the United States. And I don't think we have this issue in Canada.
It's very weird. Oh, Kylie, what's up? It's so weird, man, because I used to drink so much milk. I don't know where I found out. I was like trying to gain weight in high school football, hitting weight, you know what I mean? I used to drink a gallon of whole milk a day. trying to actually gain weight. Like it's just so weird, man. Like to
and yeah, the culture around milk seems to be a little bit strange. We get it up here in Canada for sure. Dairy's a big thing here, but yeah, that's I don't drink uh, cow's milk anymore
Mhm.
for a long time. And like uh, after the age of like I don't know 15, 16, I don't know what shifted, but yeah, it just seemed really bizarre to me to just continue to drink milk. But
Mhm.
like it was pushed heavily, as in I assume probably the same for many Americans of like uh, during elementary and high school, I mean, mostly elementary, of like you were just served milk because like this now it's your milk time. Now it's time to drink your little carton of milk. Um, but like yeah, it's so strange how that's pushed and marketed so heavily.
Yeah. Yeah.
Sorry,
I
do you
mean,
think
go
maybe
ahead.
I missed something? Do you think that milk doesn't have um
No, it definitely has benefits. I don't think it's categorically bad. It just seems strange that a significant portion of the American diet seems to revolve around milk consumption and Canadian diet as
Yeah.
well, for sure.
So there
mm,
is a weird thing that happens. I would say it really gets negative in breastfeeding, where there is a contingent, a group of breastfeed only moms that think that erroneously, wrongly, that formula is somehow bad for kids, and that is completely categorically untrue. Your baby can be completely fine and neurodevelopmentally, like completely fine through formula alone, and that it's completely good. But that is like there is like like a weird off branch of like breastfeed only, milk only people that kind of exist in the world. But I mean, there's benefits to breastfeeding that are outside of the kid basically. But anyway, that is one like subgroup where it's very fiery, and it is honestly it's a lot of the same Maha adjacent stuff, man, where people it's like that all natural, my kid isn't going to drink any processed milk, that kind of thing. It is a little weird.
As in, like, if or when I have a kid, I'm not sure that I would serve them cow's milk ever.
Yeah, I mean, you don't, so you do
No, no, no.
formula until they're like
No,
3
I'm
or
not. I mean,
something, but
even at
yeah.
like when it's healthy. Well, as in
Yeah.
they can actually consume it. As in like even at like 4 or 5 years old or 7. Like I don't
Mhm.
know that I would ever would.
Yeah. I mean, it's one of those things where your kid gets old enough when you don't want to have to do formula. It's kind of a pain to make formula, and then you just like pop the glass and put in a sippy cup of cow's milk, and you're like, oh, this is the life. This is a lot easier. So it's just a lot easier.
And probably the
So
reason for that is because like unless my consumer habit changes, like I would just never have milk in my or cow's milk in my fridge.
yeah,
Uh, I may be
yeah,
giving them like oat milk or like soy milk potentially. Um, but yeah, but even then, like this push on cow's milk. And I remember growing up seeing commercials about dairy and like it was promoted of like this is part of a healthy diet, as in like you cannot have a healthy childhood without consuming milk, was the
yeah,
overall message that I got.
yeah, yeah. Um, yeah, it's raw milk is dangerous. There's no reason for it, and people need to it's really that simple, guys. I don't understand. This is one of those things. I mean, these are the same people that like drink their own urine. You know what I mean? Like it's like this same group, man. These people will just you can't. I don't know what to tell you.
I
Like
feel like
I
there's
don't know
some
if you could.
disambiguation in that Venn diagram, just like a little
It's
bit. Like
I don't know, dude. It's a circle. It's a circle. But my point is that I think that there are just things that people believe that you just tell them, and that's just you. It's the what they don't want you to hear. Once that gets into someone's brain, that you can't get it out, and I don't know. Um, it's really interesting, like how I think that it's a really like sociology, man. The study of how people interact with culture, of how humans um, interact with what's going on in the world and form culture based off of that. Like incredible deconstruction study will be like done on how to get people back from these algorithms and try to just how do we say one of my social media content creator friends Dr. Tracy Tyson. She is coined it great. She's like, let me de-influence you, because she's a physician, she's a pediatrician, and she's like, her whole thing is like, she's been really going in on it, and I'm like, so like, yes, like, this is awesome, like, going at these influencers, like, saying this is wrong, that no, and it's awesome to see someone doing that. And yeah, I love that term, de-influence you.
Yeah, what I find most interesting about this movement is like, at least for me, the way I process it is like, at least some proportion of this is driven by whatever this focus on has to be natural. That is in like straight from the cow's udder. Okay, but even that in of itself to me is unnatural. As in like you're drinking in another species milk outside of the window of early development. It's like, and like the vast majority of the world, if I remember the numbers, like, I don't know, 70-80% of the global population is lactose intolerant after the age of like 2 or 3. And so it's like the practice itself, there's a strong case that is unnatural. So why focus on it has to be natural milk, raw, unfiltered, full of bacteria and microbes and pathogens.
It's just like the insanity that's involved. Like it's like misunderstanding of like concepts and and like the attribution of like of more like saying that it's like a moral good that we take this thing because it's natural, right? Like there's it's just like a series of logical mistakes that leads you to this point, like, of consuming raw milk like this, like a series of like misunderstandings or like a deliberate attempt at ignorance, right? Like because like, yeah, now it's become a cultural thing for you, and like this is a cultural signifier. Well, of course I drink raw milk, right? I'm not
Exactly.
gonna let those ivory tower of latte drinkers tell me what to do, right? Like, and so like to literally just to own the libs, people will drink raw milk.
Yeah.
Brilliant.
And I'm just curious, like, how far this can be pushed, because let's say people like RFK, like, they're not pushing raw whole milk. I'm just curious, like, pushing this quote unquote natural concept to its full extent. If they started advocating like it has to come straight like from the udder, as in you have to put your mouth to the udder, would they start doing that? As in,
Line up.
I want to see. Well, she's probably.
And would they do that for the sake of owning the libs? I'm gonna start sucking on this cow's teeth to own the libs.
I feel like RFK has actually done this before.
He probably has, yes.
Yeah,
is that like the ultimate expression of masculinity? Though, just like
that's what we should say. We prove it. Oh, it's raw milk. Prove it. Like,
yeah,
I don't believe you. I think you passed
yes,
it.
Corey. As a heterosexual man, I can tell you, sucking on a female boob is the ultimate.
No, female bovine. Bovine.
No.
You're missing.
Females in general, right? Sucking on a boob is the ultimate expression.
Yeah, exactly. Well, guys, I can't say it enough. It's crazy. The Trump administration wants to impose political tests on scientific grants now, like just straight up, right? So now they were doing that before he has invented this whole cloth of he actually has line item veto of how things get spent, because the OMB apparently listens to him, and so he has line item veto power, even though the legislation gets passed through Congress and Congress has power of the purse. But Trump is basically saying that basically a new proposal would allow the administration to block grants if they do not satisfy Trump's agenda or support what it calls anti-American values. The White House is seeking to exert even more control over billions of dollars in annual government grants, aiming to restrict a vast swath of funding in health, housing, science, and transportation, so that it primarily serves the purposes and organizations politically aligned with Trump. While the administration says that its primary goal is to safeguard taxpayer money, its proposal amounts to a major escalation in its attempt to reimagine the nation's spending, even as Congress and the courts continue to rebuke the president for abusing such powers. Mr. Trump's ambitions were made clear in a roughly 400-page blueprint that was released to little fanfare on Friday. If finalized, it would require all federal grants to be approved by the president's own political appointees, who must ensure that the money would, quote, demonstratively advance the president's policy priorities. For the agencies that issued those awards and nonprofit groups, local governments, universities, and other entities that received the money, the Trump administration would also impose a set of highly prescriptive and political criteria. So it's crazy. It's like the United States basically since World War II has had science as an independent body that has regulated itself through the National Science Board. The ability for science to be done was not tied to presidents because presidents come and go, but sometimes scientific research and development takes decades. So the idea is that the scientists, it's kind of technocratic in the fact that professors democratically vote on grants that are awarded. You have big pools of money that are created by these big foundations and these National Institutes of Health, National Science Foundation, these big federal agencies, and then the president does have an ability to say, hey, we want a big pool of money for cancer research, which is the Biden one, for example, which we did a really good job at. We funded a lot of really good anti-cancer medications from that. And to just explicitly say the president is going to review each of your grants and to see what actually aligns and what is going to be allowed. I mean, they've politicized science to the point of presidential veto power over individual grants.
Yeah, I mean, again, the hypocrisy of the other side, but like in my mind, it does not get more political than this. So there are, in my mind, valid criticisms to put towards how grants have been or how grants are issued or have been issued in the past. But like, yeah, this is obviously not the way to do it, or this is not the way to revise it. Especially like because as they highlight in the article, like you potentially are going to have people that have no domain expertise whatsoever, like reviewing these articles and reviewing these grants, and it's like, well, why should they have like a say, or how? I'm curious, like, yeah, how that conversation would go, like trying to explain some niche area of research with the technical jargon. For many of the reasons that you cited, of like these grants were largely approved by committees with specific domain expertise, as in science regulating itself. One, for the purposes that you cited of like, it goes past the administration, but also it's like, yes, you need the requisite expertise in order to understand the research, to put it in context, and to see its value. Now, I understand not every scientist and not every committee is necessarily like the absolute best, but definitely worlds better than going in this direction, for sure.
Yeah. I mean, like one of them, I was at a seminar once, and it was really interesting. They were talking about X chromosome silencing, because if you were born with two X chromosomes, basically one of them is silenced in this process. So because that's just what happens. It was really interesting. The study of like, they were trying to look at XY, XX, XXY, XX, the different combinations of the X chromosomes, and stuff like that, where it's like in mice, I'm sure that would just not be studied now through this, because that would be you're somehow transing the mice or something. You know what I mean? Like,
yeah, exactly.
It's like, what? Like, it was a really interesting biological like study in mammals, and now I guess we just don't care about those.
It'd be the equivalent. Well, maybe not quite as bad, but like yeah, me like reviewing some sort of like physics grant. I have no, I'm completely ignorant on that level of physics past first year university. For me to like start reviewing any high level physics grant is like that would be a stupid thing for me to do,
Hmm.
and I would almost certainly make a bunch of mistakes. Um, and so yeah, and also this just I'd imagine, I don't know for sure, but I imagine this would just like slow down the grant of approval process overall, and it's already pretty slow. Uh, and so, and this overlaps. I'm curious how this extends to the last story that we covered of like so going back to China and all that stuff,
Hmm.
where I believe let's say there's due to this administration, there's now hesitancy for some research groups to collaborate with China, right?
Hmm.
I'm curious if this administration would be like, oh, if a research group in the United States is collaborating with China, would then they now veto that? Or like, oh, you can't carry out this research, even though this may very well be valuable research because China does have expertise. China does have, as of now, world-leading institutions, academic institutions, and research institutions. So there should be collaboration. Is this going to result in just more siloing of academic research, which is probably not going to be a good thing in the long run?
Hmm.
Um, I don't know, but overall, this is bad.
It's very bad. What do you think, Prime?
I mean, I don't know if there's too much more to be said. Uh, I
Well, I
mean,
mean, they have a list here if you wanted to talk about this. The all the things that they've cut in the guise of like cutting um their um oh, where is it? Go ahead. I'm sorry if you had a thought. I'm sorry. I was just trying to help you out.
sure, I'll take it. But yeah, like I mean, I don't think there's too much more to be said here. Uh, Granting or authorizing grants on the basis of political correctness is a horrible idea. Like we've seen what this looks like during the Doge era, where like complete idiots were the ones in charge of like deciding which grants could and couldn't be um, continued, right? Even the ones that are previously approved, right? And we left it up to like 20-year-old idiots, right? Recent college grads who had no experience in the relevant fields and who literally like literally put grants through chat gpt and it says like, hey, does this sound like DEI? And that was
That's it.
ChatGPT said it was DEI. Well, then I guess that's it. like, um, and and like, in fact, I had just heard a story today that this wasn't. So this isn't a research grant. This was a uh, this was a military, I guess, grant or something, some sort of military funding stream for one of our branches there, and within the uh, the proposal or whatever, right, for the project, right, it says non-binary, so it's DEI. Well, the thing is, what they were talking about was game theory, right, and having non-binary choices, right, within within game theory,
Mhm.
like like studying what choices should you do, right? If like given these options, right, within a military, like they literally, and apparently it was a massive fight to just get that funding, but you see, it said non-binary, and so that might be a problem. The literal morons. We have simpletons. That's what a simpleton does, right? That's like a simple, like I think a simpleton does. We have simpletons running this government. And so these are the things that they do. They think it's smart. So like I don't know, man. Like we say like we see these things happening, and like what more is there to say? Like I mean, we just got a bunch of idiots.
Yeah.
Yeah, like what's gonna happen? Idiots will decide, right? And like no one can predict like what they'll do because they're dumb. And like the wind blows the wrong way and they'll approve or deny something, whatever, right? So I don't know. It's just a dumbing down of the government, and just another example of this just not being a serious, or this country just not being a serious country, doing serious things anymore.
Yeah,
Yeah,
I mean,
that's
here's
fair.
in that vein, the administration has stalled or blocked aid. This is your money. This is your money that you paid for taxpayer, like through your taxes, has blocked aid for childcare, disaster preparedness, green energy, education, food stamps, foreign assistance, mental health, public broadcasting, research, and transportation infrastructure. So, and here's the part that was like Rory was talking about. Um, Many researchers have expressed particular alarm about the implications for their work, citing the risk in having political appointees, not subject matter experts, deciding the merit of scientific pursuits. Quote, it means that all grants, not just science grants, are now subject to rules that are defined by the White House rather than by technical agency, end quote, said Cole Donovan, the director of science policy and advocacy at Stand Up for Science, a group that supports federal research spending.
It's just like, yeah, the loss of expertise, which is is this going to, are the consequences of this going to be felt tomorrow? Almost certainly not. But like, this is going to have long-term ramifications, um, where, again, this will just further cultivate the rise of China and the further fall. I mean, at least that's what I predict.
Yeah.
I
But
think. I
again,
think.
like like it's this is weird, and I'm not. This is not a criticism. But like it's just like it's the way we express this, right? Like the rise of China. China's like standing still, and then the U.S. is like face planting. Like I
Because
don't like.
Sure. Yeah, that's fair.
forward. I would describe it as they are sprinting forward and we are like standing
Well,
still.
so I would say in some domains,
Yeah,
as in like
Sure, yeah.
overall in certain fields of technology, especially as I think you highlighted earlier, Greg, in the beginning, like renewable energy, all that stuff, like their strategic investments in certain industries is paying off. But like, yes,
I guess I was.
in many other
Yeah.
respects, China is lagging behind.
To have consensus here, yes, like what Corey just said is correct, right? Like in certain key industries, they've been massively investing, and we can see them quote unquote rising. But like in terms of just like administration of a country, is China better than us? I don't think they are, right? I think they have some advantages, being
Well,
that
I,
one second.
I, yeah,
Well, let me
go
make
ahead.
the point. Yeah, I think they have some advantages in terms of like, hey, we don't have to worry about democratic processes in the same way, right? And so we can like, we can put policies through, and the other advantage being that they can have long-term planning because the party doesn't change, and so like we can just stick with something for a long time. But in terms of like like running a government, like I don't know, man. Like I don't know if they have those great advantages, but like we just are clowning ourselves. Like I mean, China looks good to the rest of the world simply by literally doing nothing. Like allowing the U.S. to
Just because you changed into your clown clothes. Yes, I agree.
yeah, I mean, like and all China do has to look like the mature adult in the room, right? Say nothing, just like watch like this clearly petulant child, have a temper tantrum, and then just like stand next to them, right? Just be the contrast, and then we say like China is quote unquote rising. It's just they're just being regularly competent. Yeah. Sorry.
True. Yeah, that's fair. I don't disagree with anything that you said. But the only thing that maybe I would push back on, but I don't. So obviously, I'm in Canada, so I don't actually know what goes on truly in the culture of China. But I think what you brought up in terms of like I think one of the differences, as of now, from my assessment, which could be incorrect, is like there seems to be in the United States and maybe bleeding into Canada as well and other countries is like this anti-intellectualism, sort of the war on these educational and academic institutions, as opposed to from what I can tell. But again, I don't actually know. China is a massive country with a massive population, so I'm sure it's there to some extent. But it seems like as of now, at least the politicians and leaders in China seem to still have a respect, or at least appear to have much more respect for actual expertise, and arguably, whatever quote unquote merit. Then, even though as much as the right, whines about merit,
I guess what I mean by that, what I meant by like advantage administration is that like in terms of like government setup, not like government attitudes within the government, right? Like,
Okay, fair.
so as far as I know, and like just like you, I have limited view into China, and everything that I get is like fairly colored and biased, like worrying about China giving us cancer drugs. But like, but yeah, like I have a very limited view. So like maybe I'm talking out my ass, but like, yeah, there doesn't seem to be, as movement against experts, or at the very least, if that is the case, uh, I mean, it feels like I'm sure there's an anti-intellectual strain everywhere, right? There's idiots exist everywhere. They can't
Mhm.
stop being born. So like, but like I think the Chinese government might be, like putting a tamp on something like that. I would
Yeah,
imagine.
exactly.
But
Probably.
yeah, but in any case, like in terms of like I'm talking about like government structure. Like, do they have that much of an advantage over us? I don't think they do. Like again, they have something in terms of like one party rule that gives certain advantages in like sticking to a policy to the end rather than like changing back and forth the way the U.S. does all the time. But like it's not like the structure of the CCP is just so brilliant, and so that
That's
they're
true.
coming with better results, right? Like yeah, like in the U.S. spent a lot for decades, like was an economic powerhouse, right? Like we have all the advantages. We still have like well most of those advantages to this day. Like the us falling apart behind is almost entirely our own fault. So yeah.
Yeah, no, I maybe one, and again, this is more of whatever a cultural or mentality thing as opposed to like, yeah, not the inherent to the structure of the government. But uh, as an example, like going back to this aspect of China's investment in renewables, I mean, I believe that comes from a mentality of like viewing the technology as good and positive, as opposed to like Trump is explicitly like he views and consistently expresses his disdain for like wind and solar energy. Though like he's all just drill baby drill because he just for whatever reason like he's anti that tech because I don't know it's green energy and therefore soy and feminine whatever that means.
Yeah,
Um,
exactly.
I've heard the argument, and I don't. I'm not going to die on this hill, but I've heard this argument that there's like a strain of evangelicalism um, that is uh, that views the earth as like mankind's under
yeah, their
mankind's dominion.
domain you could take
Yeah,
as in
For
like it's
sure.
for
Yeah.
them to extract and do whatever and mold to their
exactly.
will. Yeah, yeah,
Yeah,
for sure.
and this like has like consequences, unfortunately, consequences for our policy, and that like yeah, why conserve, right? Like it's the God told us to do what
God
we
will
want, right?
provide when those
Yeah, like
oil wells run dry. He will refill.
there, there's a famous quote by someone that like the best thing about the earth is that like you like poke a hole in it and oil comes out, right? Like this is like this kind of mindset. Like if you that's how you view the effing environment, right? Or also like, hey, I'm gonna die and get to heaven, right? And so like the worries of the earth in general aren't my problem, or like that's someone else's ability. God will take care of
That's
it,
my
whatever.
children's problem. So who cares?
Yeah, and I just so much, so like the level of psychology that goes into that. Oh my god.
you're true.
Um,
True.
but yeah, but like compare that to and like I don't again I don't understand the Chinese mindset as much, but I imagine Confucianism says something differently here. Like I imagine that there are cultural influences that guide all this. Now I'm not talking about the CCP. I'm just like the culture of
Yeah.
China, right? And what individual people, right, not just in the government, but just like within industry, and then like what like individuals will choose and support. I
Mm.
imagine that those are like guided by things that don't have that aren't stupid, right? That aren't as wild exploitative, right? And like geared to capitalism in the same way. That's my
Yeah.
thought.
No, no. I view that as in that's something that I can see as well. Um, but like, but even then, and I'm pretty confident that Trump is not as much as he'll probably cater to these people. He's not an evangelical or Christian
Mhm.
in any sense whatsoever. But for whatever reason, and he seems to overall be like pro technology. He's at least maybe up until recently, he was all like pro AI and no regulation whatsoever, right? Although that maybe the tide seems to be turning on that. But like when it comes to like renewable energy, I don't know. Like his mentality there is like super bizarre and interesting. But like even though yes, China is, let's say, hurting to some extent as a result of the war in Iran and the closing of the Strait of Hormuz. But in some sense, they're also not hurting as much as they, let's say, could or should be if they did not make these investments. 20 whatever 10 20 30 years ago,
Mhm.
where uh, a lot of whatever the quote unquote pain is buffered by the fact that, like, yes, they have heavily invested in this technology, and it's only appears to be getting better and increasing overall. That they're just going to be largely self-sufficient at some point, uh, and then the U.S. is still going to be stuck in this drill baby drill mentality.
Yeah. I mean, we weren't, the Biden administration did do an amazing job with the Inflation Reduction Act, with the infrastructure bill. Like we had $400 billion set aside for that, and China is spending hundreds of billions of dollars a year, and that was our chance to catch up. Like that was it. Like he did, like Biden passed legislation that we had been trying to pass for literally decades, and that was squandered, like that like the ability. I don't think anyone actually thought that Trump could actually raid those coffers, take that piggy bank, and then kind of like use it to offset the cost of the billionaire tax cut for the budget reconciliation. I really don't think that. I mean, even the Republican congressman, because remember, 70% of that money is going into Republican counties. So even the Republicans in the House were like, "Whoa, this is awful! Like, dude, please do not do this." So, I mean, we had a chance. Like, we weren't that far behind. I would think that the only thing I would add to your point would be, I don't know if I would think that the U.S. government system, if it's functioning correctly, I would say that it's better than like state. I don't even know what kind of what to call like China currently, but I would just say that I think that our government dysfunctional is a lot less productive, than a functional. And that's the question: is like, is a functional China government versus a dysfunctional U.S. government? And I feel like they kind of have more proclivity for authoritarian, um, you know ways of doing things. They don't have like federalism. They don't have 50 state governments, that inherent inefficiency.
They
So
can get
maybe,
stuff done, like that is
yeah.
for certain.
So I would say that, like, if that's, you know e- I would say, if we're quasi authoritarian U.S. government versus authoritarian China government, I would think that the China government would be more productive.
I,
Um,
I mean, I think we're seeing that now, right? Although, like, let's say, uh, yeah, I don't know. Like, let's. I would like to think that the optimal functioning American government, or let's say more optimal functioning American government, can outcompete and govern better than whatever the status quo is currently in China. Um, but I don't actually know. Well, obviously, no one knows for sure. But yeah,
I mean, a
it's
lot of people would say that the United States hegemony, economic power, was really driven by World War II, and the fact that, like, the UK was obliterated, and the financial capital of the world went from London to New York City, and then the United States was able to make a bunch of money by selling arms to both sides, and basically that kind of, and then on top of that, taking all the people from exile, and the scientists and immigrants that from Europe during those times, that directly led to a huge research and development spur, in regards to us being wanting to outcompete Russia, with the Sputnik missions. So You know, it's kind of like a, I don't know if a fluke is the right term, but things kind
No,
of
fluke
lined
could
up.
be a good, yeah. I mean, things like, yeah, things lined up. I hear what you're saying that like, um, uh, people assume that this is like a result of something inherently American. Oh, it was just American values or whatever,
Or did you just fail
American
upwards,
gumption
right?
or something like that. Yeah, but like, yeah, I mean, you're right. Like the industrial base of Europe was just like obliterated after World War II, um, and America was like fully intact, and in fact, better than ever at that moment because we
Mhm.
had switched to a war economy. We stood up factories, and we're just like ready to go to provide to change those factories into from making tanks to cars. Um, and yeah, we there was a brain drain, everyone like fleeing but either the former Axis territories or just like, hey man, I don't want to live in like ruined Europe, and you're telling me I could just come to America and like get all these opportunities to do research and um uh you know uh, be famous, right? Or you're like a Nazi who just like the Operation Paperclip, I think it was called, and we just like imported them. That was the thing that happened. I don't know, whatever. But like, yeah, we take all that in, and then we transform, and then we have like the Cold War comes out at a good time, and like it drives U.S. investment, like it focuses our
It unites
attention,
the
unites. I mean, I'm not sure unites is that word for
sure,
what
right.
happened there, but
Galvanized.
like
I don't know, but like,
galvanize, much better term, galvanizes the United States, right, into spending in a bunch of critical areas that happen to be quite productive, um, including space travel, right, and which had like benefits that have rebounded to us to this very day. Yeah, like a whole bunch of things, and also other thing that wasn't included in your list, Dr. Greg, um, is the baby boom in and of itself, right? Like we had a massive baby boom. It created a fantastic, workforce, energized workforce at the time to produce. And then even as the baby boomers are exiting, the workforce, are getting up there. China stepped in. China opened up its doors and became the factory floor of the world, and then we can export there, right? So we can get, as the U.S. economy might have been slowing down, we could export our production to China and get things cheaper, and all of that has helped the U.S. economy coast in a way that hasn't like, at least I think by the public any which way, been fully appreciated. Now those advantages are going away. China is well, one, less becoming the factory floor because like their wages are going up, but two, because now they are less controllable, um, international partner. Like there's tensions between us. The U.S., it has an aging population that's not replacing itself in the same way. That'll shrink in terms of its most productive ages.
Mhm.
And then prices are going up, and um, uh, uh, the U.S. is like losing its place as like the world hegemon, and so like that puts a
you're
level
starting
of
wars, although
pressure.
whatever
No, I mean that's always been
excursions.
happening. That's never happened.
Yeah.
We've never stopped doing that the entire time. But yeah, but we're just getting blowback for all the other stuff that we've been starting, right? So like we're losing all those advantages, one by one. It's happening all at once. People can see what's happening. They can feel that anxiety of like a collapsing empire. I mean, we saw it happen before, right? Like dead and gone is the British Empire, but like you know, this can happen to us too.
Mhm.
Yeah,
Sorry,
I
I
think
said a lot there. Yeah.
no, no,
Right.
nothing to apologize for. And I think there's the expression of whatever every empire has its time in the sun. I don't know if that's an
Mhm.
actual expression or not. But out of
Then why'd you say
curiosity,
it was? Why'd you-
I said I think. Well, okay, I should have prefaced. I think that's an expression.
Okay.
If it is, it's coined by me now, or if
Okay.
it's
Fair enough.
not.
It's not. That's a good one then. Good work.
um, but yeah, Greg, from what I recall, like you're, let's say, in comparison to Prime, you're more a fan of Biden than Prime is.
Mhm.
But like, uh, did you approve of his approach to China, or rather like the steps that he took to whatever curb China or slow it down?
Yeah, I mean, his targeted tariffs, I thought were good, for giving U.S. businesses a chance to kind of get ahead. But the aftermath and now looking at the kind of like the skeleton of DeepSeek, we can kind of see that they were actually like smuggling in the NVIDIA GPUs the entire time. So it probably, the effectiveness of that, maybe I don't know, maybe timid. But yeah, I think that Biden had the right approach in that you compete with China with competing with China in terms of developing new technologies that are higher up that
That's not the
are.
approach he took. Well, if I remember, like so, because I think it was him that like there was the, let's say, the banning of Huawei, right?
Oh
Like,
yeah,
do you think that was a good move? Because like at least based
I
off
think
of
that's
what I
totally
heard you
fine. I
say,
think yeah, I would allow all those Chinese cars like, and I don't have any
Well,
problem.
Hawaii wasn't a car situation, right?
telecom
Huawei,
No,
giant, but yeah,
yeah,
but also
telecom
the
giant.
cars as well. There was like 100% tariff
yeah,
on, and I think
yeah,
I
I would
assume it's
let
still
them
in
in.
place as well.
I think
Uh,
that they're amazing. I mean, like, if China is going to be producing all the majority of the world's electric vehicles, then I mean, why? Like, we should have to compete. I mean, if the problem I feel like is, um, like you get weird abstractions when in capitalism when you don't allow competition. I mean, I think like
Mhm.
markets in general are a pretty good mechanism to like just determine prices. So that's like why I don't really favor controlled economies. I'd never really feel like they're ever going to be as efficient as a market, and just allowing competition within the market, is a good idea in my opinion. uh, so I mean, he did the targeted tariffs. I do think that he was doing a lot in returns of, um, we by investing into infrastructure, by investing into renewable and sustainable energy. I mean, we would be competing with their trajectory of spending hundreds of billions of dollars a year in installing it too. Like it creates us on the economy of next generation jobs, next generation uh, equipment, equipment, regulatory jobs, and then research and development. As you have a more advanced grid, as you have a more robust infrastructure, you're going to have more engineers, architects, that are working on the latest in generation thing. So it just puts us up in that higher echelon.
so I actually agree with everything that you said, but then if I'm understanding you correctly, then you uh, you should not be in favor of what Biden did because like uh, he placed, if I remember correctly, he placed those export controls on like Nvidia chips going to China. But like, yes, there's the argument to be like, were those actually effective? Maybe not. And then he did so, but then it seems like you were not in favor of the banning of Huawei, and that like, let's say Chinese EVs should be allowed access to the American market, or rather, there should not be those tariffs in place. I think it's 100% or
I
something
guess I see
ridiculous.
Biden's major accomplishments in passing the legislation, not as like the
Okay,
tariffs as much. Like, and I think that was an aspect of it, but I I don't think that they were as effective as people think that they were, and I think that like competition is okay.
yeah, like so then I guess we're in alignment of like the investment. I agree with the investment approach, uh,
Yeah,
but I think like for example, I think we, although hindsight is 2020, but like let's say the banning of Huawei, I think only just forced it to become, well, I think it's more or less has either is built back to where it was before the banning or is now exceeded. Like it's bigger than ever because like. It forced them to become more self-sufficient and actually invest in their own research and development,
yeah.
uh, and now they seem to just be getting better and better.
I mean, because at the same point, like if there's a $20,000 EV that beats the pants off of everything else, and then we're not going to have Teslas, Honda Civics anymore because of that. in the United States, then and why as a country would we try to have like Ford, like bolstered up that's having an inferior product? You
I
know what I
agree,
mean?
but then
It just doesn't make any sense to me.
I agree wholeheartedly there. But that's where it's like, from what I understand, your your typical American car companies like Ford, I think they're even like they're turning away from electric, and like they seem to be like investing even more now, or almost like doubling down on internal combustion engines.
Well, to be fair, the market turned away, right? People
Yeah,
weren't
that's true.
buying them in the
Yes.
same way. But part of that is also like America just doesn't have the infrastructure that like
Hmm.
Europe does, because we haven't been investing. So there's a little bit of everything that's happening there. I'm of multiple minds here in terms of the Huawei ban. Um, I think we shouldn't have banned them in like a general ban against Huawei. I think that was foolish. Um, but like um, in terms of like the stated goal is something I agreed with. That like Huawei being the that company from an adversarial territory, right? Like Huawei's technology should not be within the uh, information technology backbone. So like are the backbone of the internet. So I'm talking about like critical systems deep within our like for
Should not be
instance
like the foundational infrastructure of like, let's
yeah,
not
foundational
rely on.
infrastructure,
Yeah.
right? Yeah, like talking about like should Huawei's technology be within like cell phone towers? Well, no, because if somehow China adulterates that technology, use it for spying purposes, then they have they'll get a massive amount of information, right? Like or within the technology that the servers that route like large amounts of internet traffic across the country. Like should we be using Huawei equipment there? Absolutely not. And they probably shouldn't be using our equipment. I wouldn't tell them to use American company. But in terms of like for like general purpose use, no. I mean, you could ban. I'd be fine with banning Huawei phones like from like the use within government, right? Like maybe saying government employees can't use these phones. That might be fine. But beyond that, right? Like in terms of like the regular public, no, that was a bad idea.
Mhm.
And I think it's going to bite us in the ass. Corey's heard me talk about this, but like how U.S. keeps creating its own competition. We created our own competition in terms of Huawei, like Chinese companies, because we banned them from like being able to access like Android. And they're like, okay, well, we were more or less happy with using American technology previously, right? Like the Chinese market was more or less happy of using American technology, but then you take it away from them. Okay, well then they force to come up with alternatives. They have, and it seems like pretty competent alternative. And you know what? Now, they'll eventually start selling it to us. They'll sell us a new. They'll create a new competitor to American companies. That didn't exist before. We did that in terms of the AI, right? Banning them from the chips. Okay, well now, and the ability to like buy the equipment to create chips. Like, okay, well we're just going to reverse engineer that stuff. Before that was like money that came to the West. Now they're like, oh, okay, we'll just create our own because we have the. This isn't like Cuba, right? Like the U.S. is good at bullying smaller countries
Mhm.
that have limited resources,
A small island country. That's like
limited industrial
that's
bases. Yeah, that can't like in Iran, right? Has limited industrial bases. There's only so much they can do. Even Iran is much more resource well resourced. There's only so much they can do. But like you can't bully China in the same way. They can just like say we'll do it ourselves, and that's what they've been doing. They're like we'll do it ourselves, and then once we manage it, right, we're going to outcompete you. We're just going to outcompete you again. So this will be a disaster in decades to come.
yeah, no, that's why. Like, I think again, I don't know for sure. We'll find out. But I think like, yeah, their trajectory that they have taken with electric vehicles and renewables is like, yeah, probably just going to transfer over to whatever computer chips, graphics cards, AI, probably.
Specifically with the cars is a little different though, because with cars, One, like American companies like gave them that technology. American
Yes,
companies wanted to come to China. They wanted to
and they had to build
sell
there
more than
first.
anything.
Mhm.
And they China being intelligent for on their end, they say like, well, if you come here, you have to have a Chinese partner and exchange IP with them, right? Like show them like how to do the things that you do. And those American car companies are only so happy to do that. Oh well, we want access to the Chinese car Chinese population, right? Rather than like having United Front and saying no, we're not going to do that, right? Like no, we'll agree to these terms. Okay, well then they literally changed their competition. They literally did that. They handed over all their technology, all their secrets over to the Chinese, and then like, okay, then we'll do it ourselves. So they created their own domestic Chinese market, and then did a better job and were more productive and hungry, honestly, than the other companies. So they've like So now when those American and those foreign companies used to dominate China's market, that's not the case anymore. And now, like as we see in Europe, they just creating a better product, right? So they're outcompeting the Europeans, and the only thing that is keeping Detroit alive is the fact that we're keeping out um, uh, a superior competitor from coming in.
Yeah, I agree with you that it's slightly different with the, let's say, the computer chips, because it's like, yeah, there's a core technology, that lithography technology that they don't have access to. But I think it's only a matter of time.
Yes,
They're definitely behind, but they're doing everything in their power to catch up, or like, overtake the
they'll
United
get it
States.
eventually. Yeah.
Yeah,
Yeah. Yeah,
whatever the
exactly.
timeline is, but 5 years, 10 years. But the key thing is like they're investing. They have a clear desire to be self-sufficient, and it's like, yes, if you're not going to grant us or give us the technology, we're absolutely going to develop it ourselves. And they have the expertise. Like they have now an educated population. If anything, like they have like a youth unemployment problem. Like they have all these highly educated people that like there's not enough jobs for them, because it's like, yeah, they're still growing. But like once all of that expertise is actually leveraged, I can't imagine just how much more the development is going to accelerate. But I mean, it could be wrong. I'm just projecting.
Um, totally agree. Yeah. Um, Last 15 minutes here, guys. The quick Ebola outbreak news. Um, New York Times again. As Ebola outbreaks widens, Trump has yet to outline a plan. I am sniffing like 20 January 2020. That whole idea of that he is, remember, the numbers are over there. I want them over there. And then he just denied the pandemic, denied the thing that was happening. And now here we are yet again. The quote from the New York Times: despite long established procedures for bringing Americans home for monitoring and treatment, Trump administration has not said that it will allow those at risk of Ebola back into the country. Even as the Ebola outbreak in the Democratic Republic of Congo appears poised to become the largest on record, Trump administration officials have not articulated a clear plan for caring for Americans at risk of the disease. Hundreds of Americans, including federal officials, aid workers, and journalists, are expected to be in parts of Congo where the disease is rampant in the coming months. Officials from previous administrations say that there is a clear playbook for when such people are exposed to Ebola or become ill. Bring them home to one of the 13 facilities in the U.S. built for exactly these circumstances. The U.S. does not have the authority to quarantine Americans elsewhere in the world and cannot prevent them from re entering the country. But last week, Secretary of State Marco Rubio declared that the administration, quote, cannot and will not allow any cases of Ebola to enter in the United States. End quote. The Trump administration has already shipped one American physician sickened with Ebola to a hospital in Germany, and six others with possible exposure to the virus to Germany and uh, the Czech Republic for monitoring. Public health experts closely observing the situation said that they were unaware of any Americans with risky exposures. There was supposed to be a 50-bed quarantine in Kenya, but a Kenyan court delayed that by at least 3 weeks. So that is where we stand. We are not this strain now. So the strain in 2014 to 2016 was a different strain than that's outbreaking right now. We have a vaccine for the 2014 version, but not this one. And it's still in development. Hey, Sanish.
Yeah, I find this, well, we spoke about it briefly last week, but
Hmm.
that quote from Marco Rubio, I think is super interesting and well sad and also hypocritical of like, yeah, cannot and will not allow any cases of Ebola to enter the United States. But as they say, like, these are, let's say you have American citizens, and as you read from the article, the United States does not have the authority to quarantine Americans elsewhere in the world and cannot prevent them from re-entering the country. Where it's like, but again, like this was the party that was against lockdowns and quarantine, right? So why not let them enter, right? And like what's I'm not that I want this to happen, okay, but like if a case of Ebola makes it to the United States, is this person just going to be allowed to roam the streets?
Why?
Should they
I
not be
mean,
under quarantine?
this is a great point. I mean, people always talk about natural immunity. Let's see it, MAGA. Let's see. Invite an Ebola positive person to live in your house, be exposed to Ebola.
I'm pretty. I predict. I don't know for sure. And again, I don't want this to happen. I don't want anybody to be affected by Ebola.
Yeah.
But like, if it reaches the shores of the United States, like I expect MAGA to do an about face. Like, no, this person should be under quarantine.
Yeah.
Now lockdowns matter. Okay. Yes. Our
Exactly.
freedom to not get Ebola supersedes that one person's freedom, even though they're all about freedom during COVID.
Well, I mean, they think that this is another ploy, that this is fake, and that this is not actually happening. It's only happening because of the midterms.
Okay, if it's fake, I will gladly book their ticket to the Congo,
Yeah.
to that place, actually.
Exactly. Well, then, yeah, exactly. In that case, then you shouldn't have any worry about like yeah, housing these people.
Yeah, true, true. It's all fake, so let any Americans return. There should not be any travel restrictions from these countries, whether American citizen or not. But yeah, I think it's super telling. And obviously, I don't expect anybody from the other side to call out Marco Rubio and his sentiments. But like in my mind, they should be up in arms of like depriving an American's freedom to return home. Although I'm sure probably, I'm assuming these the Americans that are being denied entry are probably healthcare workers, and so they probably understand not being allowed to return home, and they probably are almost certainly either voluntarily self quarantining, or it's probably not taking much, if anything at all, to get them to quarantine, because they understand the risk. But I'm just curious how it will play out. Of like if you have an American requesting explicitly to come home and to return, and I want to be on American soil, uh, yeah, I don't expect the response is going to be a welcome. They're not going to open up the welcome party for this person.
Hmm. Oh man, I I was trying to find it in the thing. I had read it. They were talking about like, can they actually prevent people from coming back to the United States, and they can't. But it's
At least
like,
that's what it says. And they alluded to a case. I can't
mhm.
remember the details of like I think it was like in Maine. Like someone had to like camp out in like an airport or whatnot. Uh, 1 second. I'm looking for it myself.
So basically, on Tuesday, Pigot, a State Department spokesperson, suggested that quarantining in the Kenyan unit was, quote, voluntary, unquote, for Americans who are not symptomatic. But he said that those who declined would, quote, remain subject to relevant U.S. and foreign governmental health, traveling, and screening measures, end quote. The plan for those who test positive for Ebola or have symptoms is even less clear. Officials may arrange evacuation to certain places designated as safe, the State Department said, without specifying possible locations. In the absence of a clear plan, quote, the concern would be that people would hide their exposures, end quote, said Dr. Nadeed, a director of Boston University Center for Emerging Infectious Diseases, who has been a part of multiple Ebola outbreak responses. So yeah, I mean, they would just say that they're fine. I mean,
True. That,
right?
that that's a bad incentive.
Yeah.
Like if you're sending the message that if there's any risk that you've been exposed to Ebola, then yeah, you're not going to be allowed to return home. Well, not that I would encourage anybody making this calculation, but I understand someone who would make that calculation. Oh, better to not express that I was potentially exposed
Hmm.
to Ebola so that I can return home.
Making
And
things
yeah,
more dangerous.
uh, and yeah, towards the end of the article, they mentioned this case of Casey Hickox, a nurse epidemiologist, was in Sierra Leone in 2014 and forcibly quarantined in a makeshift tent outside Newark Liberty International Airport when she returned, even though she did not have symptoms. She later successfully sued the state of Maine for attempting to quarantine her.
I
And so,
remember this. I think I
and so I'm
remember
curious
this.
as someone with Ebola, you know, again, not that I want anybody to have Ebola, but
Yeah,
you remember the case, Brian?
I think so. When's it happened again?
2014.
Yeah, I think I like vaguely remember this. Mm, I don't know. It's too vague for me to make a statement on it, but
Yeah,
Yeah,
fair enough.
um,
But
yeah,
I'm just curious how it'll play out. And like, there's a tiniest part of me that just wants to see it play out. But again, I don't want anybody to be harmed or affected by Ebola.
it's just like another example where the United States is leading on something. We have the infrastructure, we have everything set up, we have people trained for this scenario, and then they're just like, no, no.
Yeah,
It's exactly what you're talking about, Corey. It's the death of expertise. Like they just don't think, and they don't think that anyone could be an expert in this, so they just deny the whole thing, and they're just like, no, we are making this decision, and that's not the good move. And you're like, we've talked about this actually before. We have this whole thing set up, dude. Like this is, what we've been training for, you know, and they're talking about in the article. It's like, there's a lot of things that they don't have in these makeshift Kenyan pop-ups, that they do have in the United States. So like not only would the care be better, you have a greater survival rate, but also like we are literally the leaders in the world on this. So why not lead the world on this?
yeah, no, and going back to bad incentives of like, almost certainly the United States has public health officials and expertise that you would want them to be on the grounds in these areas, helping
Yeah.
out and using their expertise. But then what the incentive is like, well, if I go there and I'm exposed, I can't return. So why would I ever, as they mentioned in the article, of like, why would any, or understandably, no public health official or expert would want to go if there's the risk of like, well, they can't come back anytime soon if there's any risk for exposure, right? If they have to be shipped off to Germany, or they're stranded in some other place outside the United States, or worst case scenario, again, not that I want this to happen, but like if if they get exposed to Ebola and then have the disease, like again, you would want to return to the United States because that's, as they explicitly say in the article and as you brought up, that is your best shot at survival. But then if you're going to be denied entry, then it's like, well, yeah, why would any public health official ever want to go to these areas, which will only make the situation worse, right?
Yeah. Some of
Uh,
the comments said, hasn't Trump cut our ability to domestically track and report it anyway? So he has, in the fact that like the EPA, the CDC, all been gutted, absolutely. But also, like we're not talking about active community spread of Ebola in the United States. We're talking about people that are positive quarantining in place, basically inside of hospitals that have um, the infrastructure in order to house them, and they're in positive pressure containment rooms and all that kind of stuff, so that it's just not gonna get out. So
yeah, exactly. Like again, yeah, if someone, if I'm American that gets infected with Ebola, like I would want to be in America to be treated appropriately, because like as of now, yes, the best care that you can receive is in the United States, especially for something like Ebola. Like, but like, yeah, why would anybody want to go to these areas if there's any risk of like you're just not going to get access to the best care should the worst happen, right?
Yeah, exactly.
So sad state of affairs.
It's embarrassing. Don't worry, Europe is right here to help because Europe is awesome. That's what a comment said. I don't endorse those words. I am Ron Burgundy.
But Canada is awesome. But yeah, I think it's summed up nicely at the last line of the article of this plan makes the U.S. look weak. It makes it look like we can't take care of our own people, and we can, and you should.
Exactly. It's people. It's people. And Prime, you're so right. These are unserious people that are leading the government that don't want government to work. So therefore, when government fails, it's making their point, right? They're very easy. It's in Republicans are very effective outside of power because they can feign as, this persecution complex that ties in, beautifully into their narrative. And then as soon as they are in power, they have all three branches of government, and now they're still persecuted, guys. They're before in 2016, it was QAnon, which was this global cabal that was pushing him down, and that was the reason why Trump couldn't beat Trump. But now it's Biden. Biden is actually the reason why Trump can't do anything, or it's rhinos, or it's just there is no excuse for this. Like we are better as a country. We have spent our money on these things. Like we have some self-respect, Americans. We can I'm preaching to the choir. You guys are, this is a pro-science stream, but I'm just saying, like, we are patriots, right? We are patriots trying to make our place better, our country better, trying to America to create results that really match what we have been saying that we haven't been before. And I think that it's incredibly important, I feel like, to think about it in those terms.
Yeah, I agree wholeheartedly.
A comment here. So your best bet is infected internationally, is to keep quiet and get home and then inform airline. Yeah, probably hail. Yeah, I mean, hail the algorithm. Yeah,
Not that anybody should take that course of action, but the incentives
that's
line
what's
up in
happening.
that direction.
Yeah, exactly. That's what the Trump administration is doing. But so we are, if you guys didn't know, our friends Prime and Corey they are from the East Coast. They're
The best coast.
they're living there because they want to, they're day traders that want to be opened with the market at 9:30 in the morning, and it's really admirable. But
No,
so,
I'm on the East Coast in Quebec, Canada, because that is where Canada holds its strategic reserve of maple syrup.
there he is. So we're gonna start trying to make these like a tight 2-hour show for everyone. And honestly, I really liked it. It was actually really nice to like a tight 2 hours. So then it's more listenable, I think, afterwards. And these guys get to go to bed, not at 3 a.m.
As if I leave my room.
Prime is just waking up now. Actually, I'm gonna go to bed.
Yeah.
All right.
Well,
So thank you guys.
Yeah. Thanks for having me. It was a fun conversation as always, sparring with you guys, or just like commiserating, like on the misery, one or the other. So I appreciate anyone coming through and listening and being kind. Follow me at Twitch, YouTube, Kick, Prime Kai, PRIMECAYES. Do debates. It's a lot of fun. Come join us.
And as always, this has been great. Both as Prime said, the commiserating, but also the sparring every once in a while. But yeah, you can find me on Twitch, Corey Campbell 84, Twitter, X, YouTube, Instagram, Substack, TikTok. It's Corey Campbell. And yeah, always a pleasure. Look forward to next week.
All right, guys. Thank you so much. I appreciate you.
Take care. Be well.
Bye.
Okay. Thank you to anybody that passed by. 1 second. I think I missed probably a few people. Overused True Toy, thank you so much for passing by. You're probably not still around, but either way, much appreciated. And Hillbilly Stein, Dr. Demand, and Marshmallow, thank you for passing by and for your feedback and comments. And so, yeah, that's it for this week. And she'll be back next week. And until then, take care and be well.